Senator Halpern, if you don't mind, what number are you on? Number 3. If you open us up with prayer.
Heavenly Father, thank you once again for bringing us together so that we can do the good work for the people of Georgia, focused on their well-being and their health. We pray that you give us guidance and discernment as we go about the business for the people. In all these things we pray. Amen.
So last week we introduced the new members of the committee and failed to introduce the behind the scenes. So Sydney is here from Senate Press. Annalisa is our intern this session. Royce Crow takes care over for Kaylin and administrative assistant, and I think everybody else is the same. Thank you very much for everybody. So we have Senate caucus has a press conference at 3, so I'd like to adjourn at 2:45. So if everybody back it up and sort of understands the time frame that we're dealing with, we'll have to sort of be very brief and to the point. And with that, we'll open up with our first bill, Senate Bill 6, Chairman Kirkpatrick, and we do have some public testimony, and we have a substitute, and I'll let her go through this, and an amendment. The floor is yours.
Thank you, Mr. Chair. I'm going to stay here, if that's
Yes.
okay with you, and hopefully we'll do better than the previous committee did in here. As you guys know, drug overdoses are a big problem in all of our districts, and deaths are still very common. In 2022, 67% of overdose deaths in Georgia involve fentanyl. In 2022, we passed a bill authorizing fentanyl test strips to legalize tools to check for the presence of opioids like fentanyl. Now, there's a non-opioid drug called xylazine that is causing harm to Georgians. Since 2022, the percentage of overdose deaths involving xylazine has increased from 0.8% to 9%. And 100% of suspected xylazine overdose deaths in 2022 also involve fentanyl. These can involve people from all walks of life. Fentanyl is commonly understood as a street drug, but xylazine is another street drug that does not respond to naloxone because it's not an opioid. It's a horse tranquilizer that is used by veterinarians. And on the street, it's known as Tranq. Sometimes it's used on its own or in combination with other drugs. It causes various serious health issues, including death. The DEA put a report out on the growing threat of xylazine in 2022. There's a wide range of other adulterants and even industrial chemicals that are harming Georgians, and it's not known what the next adulterant will be, whether opioid or not. The latest one I've read about, I can't really pronounce it properly, I'm pretty sure, but it's called metadamidine, which is also known as Rhinotranq or mead, and that's one that none of us have ever heard of. So what this bill does, in simple terms, is it broadens the bill that was passed along with House Bill 1185, which was the raw milk bill that some of you may remember, to include tools like xylazine test strips or any other tests that may pop up for these adulterants that are contaminating drugs. It's not uncommon for us to pass bills on specific substances, but we end up having to fix the bills the next year because the next drug has popped up. So the approach that was taken with Senate Bill 6 is to broaden it enough that it would cover all of these things in the future. And so I don't condone drug use, and I work hard on prevention and recovery efforts with the community. However, while we're still working on long-term solutions, our citizens are dying, and I hope you'll agree that saving lives while we're trying to get people in recovery is a high priority for all of us. The bill is the pertinent language, and it's LC 570193S, which should be in your folders, is at the very end. And this is a little bit lawyerish, but we need to tweak the language there even a little bit more from what I have in the bill. And so I don't know at what point you want me to.
I'd go ahead and do that now.
Okay. So what I would like to do is make a motion to amend the language, and it will now say, starting on line 18 in the sub, that any drug analysis equipment used to lawfully determine whether a controlled substance or its packaging has been adulterated shall not be considered a drug-related object as defined by Article 2. And Sarah can correct me if I didn't say that right. You got it perfect. Okay.
And I'll second it.
Okay, thank you. Any discussion on that? Senator Magnin?
Basically just took out "and the controlled substance packaging." Is that, and the
The
implication?
packaging's still in there, we just moved it to a different line,
Okay,
just to make it more clear.
okay.
That's what the lawyers advise us to do, so
Right, so-
it does the same thing.
So I got further lawyer advice back here, so, and it is accurate. We do need a due pass, and then we'll need to do the amendment, so. Yeah, why don't we do the due pass and get the amendment, and then we'll do
got
questions. How
testimony,
about that? You want?
Chairman, I make a motion to pass.
It's certainly much appreciated.
570193.
Okay, and seconded there. All those in favor, say aye. And,
want to be sure the drug.
oh, that's right. Let's take that back. That was out of order. Okay, where's my gavel? So.
Yeah.
I see.
Y'all's motion is bad.
You did that.
Yeah, but don't vote
Let me
on
see.
it.
Yeah.
And there's also,
Yeah, no joke. I got it. So let's go ahead with the discussion. Where's,
and there's testimony too.
yeah, and let's do the testimony, and then we'll get the ruling on the logistics of that. Let's do the testimony. We got, I think, 9 people who signed up to support on a little bit of a time crunch. If you want to line up, if you want to say who you are and that you support it, let's, 1 minute or less, you can just say you're supporting it. All right. Mr. Breedlove.
With the Georgia Council for Recovery and a person in long-term recovery, and I'll be brief. First and foremost, thank you to Senator Kirkpatrick for bringing this legislation. It is supported by many people and families and organizations across the state. I've had I think the word is privilege, to visit Philadelphia twice, to the Kensington community, which is ground zero for xylazine. I want to tell you, you have never seen that kind of hell in Georgia yet. Hundreds of people, any given day of the week, in broad daylight, zombie-like state, overdoses occurring by the dozens every day. We've been blessed to have a small invasion of xylazine in Georgia. There have been deaths according to the GBI. So thank you for this legislation, because I've seen what it will do to my brothers and sisters, and this will save their lives in Georgia. Thank you, sir.
Thank you, Mr. Breedlove. Mr. Hayden and Andy Gish after that.
Chairman, members of the committee, my name is Mark Hayden. I'm the Director of State Government Affairs at the R Street Institute, which is a free market think tank that supports limited effective government in many areas, including harm reduction, and that's why this bill is so important to us. In the essence of time, I'll keep this very short. We at R Street, we believe that, we don't support or encourage any sort of illegal drug use, but we understand that abstinence-only approaches simply don't work for everybody. So we look for ways to reduce harm where it can't be entirely entirely eliminated. And legalizing more broadly drug checking tools such as this, we believe that is the way to go. And one point that I wanted to make to piggyback off of Senator Kirkpatrick is that xylazine deaths between 2020 and 2022 have surged by 1,380%.
Thank you,
And I
Mr.
really appreciate your time.
Thank you. Andy Gish, then Sarah Fabrice Cordero.
Thank you so much. My name is Andy Gish. I'm a board-certified emergency room nurse who's been on the front lines of the opioid epidemic for 20 years now. I've lost friends and loved ones to substance use disorder and overdose, and I still have others out there at risk. As the executive director of Georgia Overdose Prevention, I worked alongside you to pass the medical amnesty law, and that's where we all met. Over the past decade, we've listened to the people that we serve, and their experience confirms what research shows, that when individuals know what they're consuming, they make better informed choices. I'm here to voice my support for Senate Bill 6 because we know it will save lives, and its flexibility allows us to adapt to an ever-changing illicit drug supply. Evidence-based research shows that people who use drugs are 5 times more likely to change their behavior, including reducing use or abstaining, if they test their substances before. And I'll tell you that this is a statistic from research, but I've had somebody in front of me before who was given a pill by someone who loved them very much, and they didn't know what was in it. And she became the experiment because she took her own drug test afterwards and found out that she had drugs in her system that she did not intend. Too often we find that we get this information post-mortem after a fatality has happened, and we don't want that to happen in Georgia. We want people to live.
Thank you.
Okay.
Appreciate that so much. Sarah
Yeah, hi, I'm
Cordero,
Sarah
Jeremy
Febres
Sharp
Cordero
on deck.
from
Okay.
Emory Nell Hodson Woodruff School of Nursing. I'm an assistant professor there, and I'm a CDC-funded researcher who's assessing barriers and facilitators to drug checking in Fulton County. I wanted to talk about strengthening Senate Bill 6 with adding the term "and packaging." Drug checking technology has advanced significantly, providing individuals and communities with critical tools to ensure safer drug consumption. Many individuals who engage with drug checking access health care and harm reduction support through county boards of health and harm reduction organizations. In these settings, we educate individuals on how to check their substances using testing strips. For these initiatives to be successful, individuals must feel safe bringing drug samples in or packaging for analysis. I wrote a lot more, but I'm going to skip quite a bit of it. And if an adverse event occurs, individuals must feel secure bringing in packaging for analysis without fear of legal repercussions. People who use drugs and those with substance use disorders do not want to die, nor do they want their friends to die. The most effective way to disseminate emerging drug trends is through peer networks, but this requires safe and supportive environments for individuals to participate in drug checking efforts. Thanks.
Thank you. And looks like Jeremy Sharp or Mark Parnell.
Thank you. My name is Jeremy Sharp, and I'm here representing Georgia Overdose Prevention. I'm a founding member of this organization. We're an organization that works directly with impacted individuals, people dealing with substance use disorder. Every day we're on the front lines providing life-saving resources like naloxone and drug analysis services, as well as other harm reduction services to people. We help people make informed decisions and connect them with essential health services, ensuring they have access to the care that they need. In short, this bill isn't just about policy, it's about people. The individuals who come to us for help are often in life or death situations. For many, using drug analysis equipment can be the difference between a fatal overdose and a life-saving decision. A positive test result may encourage someone to use a smaller amount, take extra precautions, or seek medical help. Research has consistently shown that when people have access to testing equipment, they change their behavior, and that prevents overdoses. As somebody who's been working directly with people for over 10 years, I do believe this is a life-saving policy, and I encourage you guys to pass it with the amendments. Thank you very much.
Okay, Mac Parnell.
Mac Parnell with the Georgia Faith and Freedom Coalition. We are in support of this, and I'd just like to thank the Senator Kirkpatrick for her strong leadership on this. Thank you.
Tony Moon.
Yes, my name is Tony Moon. I'm with Rising Sun Recovery and a Pauline Recovery Community Organization. I'm also a member of Georgia Association of Recovery Residences. This bill, what it will allow us to do is we are like on the front lines. We're constantly helping people create a safe environment. So this bill would allow us to be able to test for an ever-changing drug environment that we do on a regular basis. Thank you so much.
Candace Whittaker?
Hello, my name is Candace Whitaker, and I'm the Executive Director of the Georgia Association of Recovery Residences. And we also are on the front lines working with and certifying over 80 recovery residences and over 3,000 daily beds in the state of Georgia. We work with ERs, the Department of Public Health, and Thor, and we support this bill.
Thank you. We're going to hold for just a second. When the chairman comes back, we'll proceed.
She nailed it. Made him speak quick.
It's much appreciated. The first thing we need to do is entertain a motion to reconsider our vote that we did earlier. So I'd like a motion from the committee to reconsider. Yes, thank you. All those in favor of the reconsideration can say aye. Okay, that's unanimous. So now we're in the appropriate aspect of that. So we have,
Read it again.
yeah, so we have an amendment to the substitute for Senate Bill 6. And,
Make sure I give you the correct language this time.
okay,
You want to read it?
Mr. Chair,
yes.
move that we amend, let's see, 570193S with the amendment she's about to read.
Okay. Second. So we're going to read the amendment and then we'll vote on it.
Okay. So now, starting on line 18, it's going to read that drug analysis equipment used to determine whether a controlled substance or its packaging has been adulterated shall not be considered a drug-related object as defined by Article 2.
Okay. So any questions on that, any discussion related to that? Thank you. Senator Hatchett and Senator Chairman Kirkpatrick.
Man,
You got a question?
Got a question? Do you have a question?
it seems like this is one of those that everybody's singing kumbaya, but who is against this?
I don't think we've had anybody voice any opposition to this. We
'Cause
just
it-
want to make sure we get the language
Right,
right.
Yeah, the cartels probably wouldn't like it
I know,
much.
so, because it's one of those, one of the few times I see something that it's great.
Appreciate
situation.
your thoughts.
We always sing Kumbaya in Health and Human Services.
Just like rules. Just like rules. That's it. That's it.
So do we vote on the amendment?
Yes, so let's vote on the amendment. All those in favor of the amendment, say aye.
Aye.
All those opposed, like sign. Passed unanimously. And so now, any discussion on the whole bill? No further discussion. So we have the SB 6 as amended. We're all correct? All right. And so we have a motion as amended, a motion from the Chair of Rules, seconded by Senator Hatchett. Anything further? All those in favor say aye.
Aye.
Opposed, like sign, so it passes unanimously. Thank you. All righty. So thank you. So we got about 15 minutes to do, we wanted just a couple of educational aspects of that, so we'll give maybe 5 minutes to each and a couple of minutes of questions. Mary Boatwright Quinn and Nancy Petra, Georgia Report on Dementia, which is in your packet, and then Lynn Durham, colorectal cancer's impact in Georgia.
Chairman Watson, members of the committee, thank you. I'm Mary Lee Boatwright Quinn. I am the Assistant Deputy Commissioner of the Georgia Department of Human Services Division of Aging Services. And we're going to do just a quick tell you what this dementia report is so that you can go and read it, the full report online. And I have with me Nancy Petra, who is the GARD Advisory Council Chair, and she's with the Alzheimer's Association.
Thank you, Mary Lee. Yeah, so quickly, I won't go through the timeline, but the GUARD plan is something that was established early on. And last year, there was a bill that came through this committee, and Senator Kirkpatrick carried it to the floor for us at the beginning of the session to allow us to bring you a State of Dementia report at the beginning of every biennial, and then every 2 years in between that, we'll be giving you a progress on what's going on with the GUARD state goal plans, but we're here today to walk you through this first dementia bill.
Yeah, so the first dementia report has a number of focus areas, including risk factors, prevalence, mortality, cost and burden, and access to care, as well as what the state is doing about all those things. So I just want to highlight for you, when you go to look at the report, we partnered with the Carl Vinson Institute, and they helped us to develop heat maps. And those heat maps are by county, as well as public health district and area agency on aging. And our hope is that you'll take a look and see how dementia is impacting your district and the people of your district. So as far as risk factors go, I just wanted to mention, because this is a really important part of the report, you will see that a lot of people don't realize that 40% of Alzheimer's and dementia cases are from modifiable risk factors. Most people think it's genetic, and if you have it, you have it. But if we are working on health, and health impact, then we're impacting the brain, and we're reducing risk of dementia. So please take a look at that area. In addition, on the next, there's prevalence data by public health district. Here you see the map, and that the southern Georgia area has a higher prevalence. And you note from the previous slide that that is also in part because they have also a higher prevalence of all those comorbid conditions. So moving on to the next part of the report is mortality.
Just quickly, I want to just note that you'll see that there is a higher mortality rate for women than men. And then also women tend to be more caregivers. We do have a whole section on caregiver burden in the report. So women are impacted by this disease in 2 different ways, more than anybody else. And here we noted a little bit of the statistics for you in the executive summary. Please do look at the full report. The Georgia Memory Net did some surveys. We've highlighted those details in there as well. And we've circled the top. Caregivers, one of the things that they reported, their takeaways from those surveys, is that they still lack an understanding of dementia. So your Division of Aging Services, your partners at the Alzheimer's Association, we are continuing to work on that, as we know that that's something that we need to address. Specialists in Georgia, this is not going to come as a huge surprise to all of you. As we all know, there's been a healthcare workforce shortage kind of across the board nationally and in Georgia, but we just kind of wanted to highlight here that we are lacking in specialists. And as you all know, that the aging cohort is the fastest growing population nationally and in Georgia. We are not going to have the demand of specialists that we're going to need. And right now, they're really just mostly in the Atlanta Regional Commission service area. So this is an area where, we really need to see some impact and growth in that area.
And I am going to get to talk about all the investment that you all have made. Our state actions have really made us a star in the area of dementia. I get a call almost every week from other states on what we're doing and how we're doing it. And a big part of that is our Georgia Memory Net assessment clinics across the state, and you'll see that where the locations are of both our clinics as well as our new public health telehealth sites that we're continuing to develop are addressing those areas of prevalence that were on the previous maps. So thank you for your continued investment. And that was in part, if you go to the next slide, we also have that education that Nancy was talking about going on in all of our area agencies on aging due to an investment that you all made with the Dementia Care Specialist program. So, and then we're going to give you a link here on the next slide to the full report. You also received last week on your desks in the Senate the executive summary. So that highlights some of what we talked about today, but the full almost 30-page report is on our website. As well, we have a progress report on GUARD that is there for 2024. And then our contact information is on the next slide, and if you all have any questions.
Any questions from the committee? No, thank you all so much. That was a very succinct, much appreciated, and and pointed us in the direction if we want more information. So really proud of what y'all are doing. Thank you.
Well, I just want to echo, thank you for your investments, because it does make us a leader.
Nice to get some positive feedback, isn't it? So, all right. Thank you, Ms. Durham. Certainly good to see you again.
Thank you. You as well.
The colorectal cancer impact on Georgia.
Yes, thank you so much. I am Lynn Durham. I'm President and CEO of Georgia Core, the Georgia Center for Oncology Research and Education, for those of you who don't know me, where we're working to reduce the burden of cancer through education, research, and advocacy. Can you go to slide 4, please? I'm going to cut through a couple of these to make it quicker on you. So I just wanted to let you know, we've been talking last year, actually, Senator Butler came into this committee with a resolution, and it was amazing to me how many of you spoke up and said, I know someone with colorectal cancer. My brother, my sister, my friend. And so we wanted to highlight it a little bit. So cancer is still the state's second leading cause of death. Over 5,000 Georgians will be diagnosed with colorectal cancer this year, according to the American Cancer Society, and over 1,600 will more than likely die of colorectal cancer. And what's so frightening right now is colorectal cancer is expected to be the leading cancer killer of people under the age of 50 by 2030, with that increasing 1% to 2% a year. So many more people under that screening age. Screening age is down to 45 now, but people under that age are still getting colon cancer at a higher rate. Next slide, please. This was a report by the folks over at Medical College of Georgia in Augusta, looking at rural patients and what happens with rural patients. And early onset colorectal cancer, the survival rates are lower in rural patients, and those with persistent poverty, it's even lower than that. Next slide, please. And this is a program that we have, and we are funded by the CDC. We're in Southwest and Southeast Georgia. We have partners. You see our partners' logos up there. And we work with them to get screening for colorectal cancer for folks who can't afford it, who are uninsured or underinsured. We have 20 healthcare clinics working with us. And over 5 years, we've brought in $5.4 million to Georgia. And we've tested thousands of patients to see if they have colorectal cancer. Next slide, please. And if there's any way you can press on that YouTube link and see if that works, he can tell you more than I can ever stand up here and tell you. Let's see if it works. Nope. Oh, try real quick, and if it doesn't, then I'll move right on. There we go.
Hey, my name is Sable Fleming, and I am the clinical liaison here at East Georgia Healthcare. Today, I have one of our colorectal cancer patients.
My name is Sean Jordan Pittman, and I go to the doctor here under Miss Lauren Davis.
Mr. Pittman, how did you hear about the colorectal cancer program?
Miss Lauren Davis recommended me I have a colonoscopy and have it done, and then they found a polyp.
And was it easy for you to go through the screening process?
Yes, ma'am.
Okay, how was the navigation part? Was it easy? Did they call you?
They called me, told me exactly what I need to know and how to do it, and I had no problem going right through with it.
What would you tell your family and friends or neighbors about getting screened for colon cancer?
It's a good thing to have done because, unlike me, I did not know I had it, and thank the Lord that my doctor was mean enough to make me go take it. And I love her for it now because they found out I had the stage 1 cancer, and they got rid of it.
So you had no...
Sorry, we've got some music going on in the background. Well, that's okay. I'll run.
Symptoms prior to your screening? It was just a routine screening?
Just a routine screening. I become that age, and she said I need to go see about getting one done.
So what was your initial reaction when they told you you had colon cancer?
It scared me to the point of just sitting in shock.
Right.
Because I didn't know what to do. All I know is my Dr. Bishop assured me that he would take care of me and he would get rid of it. And he done what he said.
Yep. So within actually a month of you having your colonoscopy where they found
You
the
can
polyp,
stop it now if you want to.
Month,
Thank you. Thank you so much. You can go to the next slide. I just wanted to show you Mr. Pittman because this is very much the folks that are seen in FQHCs in Southwest and Southeast Georgia. He is from Vidalia and had absolutely no idea that he had colon cancer. He went in, he was convinced that he needed to take the screening, and that's some of the hardest part, as you on the panel who are doctors know, to be able to get people to take the screening. Next slide, please. But he did, and he had colorectal cancer. So I'm going to tell you real quickly, we have a Catalyst grant from a national group called Fight Colorectal Cancer, and so we're working with them on policy issues. The great news is you all have already done a lot. So for Georgia, there's already coverage for screening at age 45, and there's already coverage for a follow-up colonoscopy after a positive test, stool-based test. It is a continuation of the screening process to get a colonoscopy. Unfortunately, some coders are not educated and don't realize that, so they're coding it as diagnostic instead of as a screening, and people are having to pay. And so we're working with coders across the state on that. We're also communicating to agency leaders. We've met with DPH, we've met with others, with Department of Insurance, to communicate the coverage and make sure they're communicating to those who are covered. And then we want to do a statewide awareness campaign. Next slide, please. Two things we're coming to the legislature this year is, one is the amended budget ask for $250,000. We're asking in one-time funding because we want to do a statewide campaign to let people know the signs and symptoms of colorectal cancer. So many times people have blood in their stool, say they're 35 years old, they have blood in their stool, they don't go to the doctor, they don't get it checked, and so it's a year or two later and suddenly they have stage 4 colon cancer. We want to make sure people know what that is, and we're hoping that you'll support having that. And then last is, this is in the House. We're doing a House study committee on the creation of a Cancer Care Access Committee to really look. It's been 25 years since tobacco settlement funds have been used for cancer-related activities. We want to look at that. What are the great things that have happened, but what are the things we still need to do to improve cancer care in Georgia? So I thank you all so much for letting me speak.
Thank you so much. Good to see you.
You as
Quick
well.
question.
I know that home stool screenings are kind of popular right now.
Yes.
Providers are opting to do that instead.
Yes.
I'm a skeptic in that, so my question to you is, which is really better? Is it, and I understand that my colleague was saying, you know, those that live in rural areas, that might be the best way to start, but
Yeah.
is it really, how accurate
Well-
are the at-home stool tests versus going in and having the procedure?
Right. The colonoscopy is the gold standard. That is, the colonoscopy is going to be the best thing you can do. But stool test, the Cologuard, which is the stool test you see on TV all the time, I'm not sure. I think it's about 94% accurate. Is that right,
So
Mr. Chairman?
it is as good as a colonoscopy picking up cancer.
Right.
It's about 50-50 on picking up the precursor to cancer, the adenomas.
Yeah.
The polyps, so to speak. So obviously, if you do a colonoscopy, you see the polyps and the cancer.
Right.
This guy had a polyp that had cancer in the polyp.
Yes, he did.
That
Yes,
had
he
not
did.
spread.
Okay.
Yeah.
So.
And there are other FIT tests too, which is another option, and that's a little bit lower percentage. But as your colleague said, it's a great way to get started if you don't have access. And right now, the number of GIs in the state, it takes 6 months sometimes to get an appointment for a colonoscopy. So if you can do a Cologuard or a FIT test, it's much better than doing nothing.
Quick question from
Yes,
Dr. Kirkpatrick.
this is a subject near to my heart because both my parents had colon cancer, so I'm on the 3-year schedule. But
yes,
anyway, the statistics about the increasing number of cases. Do you think that's because we're doing a better job of diagnosis, early diagnosis? Do you think it's because we're doing better with the other kinds of cancer, or how do you account for the increase?
We, meaning this Fight Colorectal Cancer group out of DC and all of us who work with them, have been trying to get research into that so we have a definitive answer. Right now, I think it's two things. One is exactly what you're talking about, increased screening. Screenings are going up because people are more aware that they should be doing this, and so that's catching more. And so that is one issue. But the second issue is really, we think it's more dietary. A lot of what we eat as Americans can be problematic to our digestive systems, and so they're looking at that to see what kind of relationship there is between what we eat and this younger onset of colorectal cancer. But I don't have definitive proof right now.
So it's the mutations. The question is, why do you get the mutations? Is this what it's going to amount to? Thank you. Sure.
Just mainly a comment. I do anesthesia. I've been in on hundreds of these, and I can tell you all 4 people in the room are looking along with the doctor, helping him out on that. And I've lost several family members as well. But I could tell you many, many stories of somebody that we put into surgery, general surgery, within a day of that to take care of this. There's a lot of success stories of people that got caught and were immediately fixed in this.
Right.
And so yeah, I hope everybody does their screening.
Well, that's the thing about screening. This is the one screening where they can actually prevent cancer. So
Yeah.
you go in, and when you take out those polyps, you're preventing cancer. And so everyone needs to do it.
Thank you so much.
Thank you.
Appreciate that. And meeting's adjourned.